I'm feeling rather old because I just realised the first ever Eurodad conference I went to was in 2001, which was in Switzerland, and everybody was very excited about fair and transparent arbitration processes for debt workout mechanisms, which is unfortunately something we're still talking about 14 years later, but it's absolutely fantastic to be back at a Eurodad conference. And just one small anecdote on the point about sort of politicians changing their positions. I was in DFID, as Tove mentioned, and I was in DFID at the time of the Accra High-Level Forum on Aid Effectiveness. And I very distinctly heard the minister at the time, Douglas Alexander, in Accra, say, I met with the UK Aid Network NGOs yesterday. I told them I was going to go to Accra to push for an ambitious outcome. He actually arrived in Accra to be told that the negotiations had closed and there was nothing more for him to push for, and it wasn't very ambitious. And he actually reopened the negotiations at that point. And one of the reasons very distinctly was the meeting he had with the UK NGOs the previous day. So, I mean, everything is possible. On that note, I'm going to talk about the unambitious goal of how do we be the first generation to end poverty. As somebody said earlier, I think it's a really good way of framing the discussion. So my presentation very much is focused on how do we finance Goal 1, and particularly some elements of SDG Goal 1, which is end poverty in all its forms everywhere. I am a bit more focused on aid than some of the discussion earlier. That's not to say that other issues are not important, but I wanted to look at one part of the picture. And the research I'm going to present is very much drawn from this publication, of which there are some copies outside, called Financing the Future. And there's the executive summary is in orange. So if you want to know more, please do pick up a copy. So, without further ado, can I have the first slide, please? So I think all of us know this, but there has been massive progress over the last 15, 20 years or so on reducing extreme poverty. The overall line is the number of people living below the extreme poverty line, and then there's a regional breakdown. I don't know how well you can see this, but the thing that I wanted to highlight is if you look at the bottom, which is the orange, yellowy-orange line, that is the sub-Saharan African line. So essentially what this chart is showing you is that we've seen very rapid reductions in poverty, but actually not in sub-Saharan Africa. We're actually seeing an increase in absolute numbers of people living in poverty in sub-Saharan Africa. Now, a lot of people, next slide please, have done a lot of projections on what is going to happen to the poverty trends between now and 2030. And I think there's a kind of a good news message here and a bad news message here. The good news is, if you put the most optimistic scenarios about growth and inequality into your models, you can get fairly close to zero extreme poverty. It's not impossible. You can get to a kind of 3% type of level of poverty by 2030. If, however, you have less optimistic scenarios on growth and inequality, actually, you can't see it very clearly from these two slides, but actually you could end up with a flat poverty line, so a no reduction in the proportion of people living below the poverty line by 2030. So it's really critical what happens to growth, how inclusive that growth is, and what happens to inequality over the next 15 years is absolutely critical to how we are going to get to eradicating poverty. None of these scenarios, by the way, factor in climate change. Climate change obviously is another additional risk that's likely to push more people into poverty over the next 15 years. So the headline message there is really, it's achievable, but we need to see the right kind of growth, and we definitely need to see action on inequality. Next slide, please. The other issue, as with the trends we've seen so far, is that we are going to see, most of the projections suggest, a much, much greater concentration of people living in poverty in sub-Saharan Africa and also in fragile states, which you can't see on this chart. But what this chart shows, again, the yellow bar is sub-Saharan Africa. So if you look at the distribution of poverty in 2011, roughly equal in sub-Saharan Africa and South Asia. If you look at what's likely to happen by 2030, it is almost all going to be about people living in sub-Saharan Africa, people in poverty. The other point is around fragile and conflict-affected states. There's different projections on this, but the projections tend to agree that somewhere between 2/3 and 3/4 of poor people will be living in fragile states by 2030. So whatever Addis delivers, it's got to work. If it's going to really tackle extreme poverty, it's got to work for people living in fragile and conflict-affected states. Next slide, please. So there are obviously many things that you can do to eradicate extreme poverty, and some colleagues at ODI and in other organisations through the Chronic Poverty Assessment Network, Advisory Network, have looked into this in some detail. I'm going to just really focus on three here, which are social protection, free basic universal health care through universal health coverage, and free primary and secondary education for all. And I was actually very interested that the UNDP speaker in the last session was saying that these were elements of countries that had made rapid progress over the past 2 decades or so. Now, this is obviously only part of the picture, but on the social sectors, these are the things that we absolutely need to do to both tackle poverty, to lift people above the poverty line, but also critically to stop people falling back into poverty. That's one of the critical things with health. People can escape poverty, they have a catastrophic health event, and then they push back into poverty. The other thing I really, really want to emphasize here is that the evidence on balance shows that these things really need public money. Now, one of my biggest bugbears in the SDG financing debates is people saying, we need $1.5 trillion of money, we don't have enough ODA, therefore we need the private sector to fill the gap. I think, for me, that's misleading in 2 ways. One, because I think you need to look specifically at which sectors you're talking about in order to know what kind of money you need. So if you're talking about renewable energy generation, you're not expecting the public sector to do all of that. You probably need the private sector, you need to have the right incentives and so on. If you're talking about universal health coverage, social protection, and education, generally it's public money you need. And there's been a whole debate on user fees and all the rest of it, private provision of healthcare, but this is really where the evidence comes down, that it's about public finance, not necessarily public provision, but definitely public finance. So that's the kind of real thing that I wanted to emphasize. So when you're thinking about public finance, you then have to start thinking, how much of this can countries fund themselves, and then how much needs to come from the international community. And this is where we have done a bit of country-by-country analysis. Next slide, please. And all of this is in the paper if people want to know more about the methodology. But what we essentially did is to look for a group of 89 countries, which is all the countries above 1 million population and a 1% poverty rate, and to look at what are the per capita costs of health, universal health coverage, basic quality primary and secondary education, and cash transfers, which is our sort of proxy here for wider social protection. How much is it going to cost per country? What is the feasible tax revenue that countries have under the sort of current conditions? And this is based on IMF and World Bank assessments of potential tax revenue in the country, and then existing levels of aid. And we then mapped these things together to say, okay, how much could countries actually fund themselves? And what I've only shown on this chart the low-income countries, because if I did all countries, it'd be very difficult to read. But the headline is that the really, really, really big financing gap is in the least developed countries and the fragile states. There's a lot of overlap between those categories. Actually, most middle-income countries turn out to be able to do this themselves for these sectors. Possibly not for others, but for these sectors, they can fund it themselves. And interestingly enough, the cutoff comes at roughly, there's some lower middle-income countries that still can't do it, but the cutoff is round about the kind of lick-mick split. And you can see the really big gap, which is the gap between the yellow line and the green bars, comes in the really, really, very, very poorest countries. So we add up all the costs. Adding it up per capita per country, we work out that what we need is about 148 billion, what we have is 75 billion, and the shortfall is 73 billion. Now, of course, there's huge assumptions that one has to make. These figures are very imprecise, but that gives us a kind of rough order of the scale of magnitude. So that gap, and I know financing gap discussions are very unfashionable, nobody likes to talk about it, but I think it's a really important thing to talk about. You know, we need to fill this gap either through aid or through taking radical steps on tax, improving tax capacity, illicit flows and all that. And in reality, we probably need to do both of those things simultaneously to raise that kind of level of resources. So particularly focusing on the aid side, because others are much more expert than me on the tax side, we've got 5 main recommendations for what all of this means for Addis. The first one, we've talked about this already, and it's obvious, but nevertheless worth emphasizing, is really recommit to the 0.7% target. Actually, if all OECD countries committed to that target, we would have more than enough money to fill the financing gap that we were talking about. The second, and I know this is controversial in some quarters, but is really about how do we bring emerging economies into the development financing system as contributors. The third, which also came up in the last session, is about being much more ambitious about how much of aid goes to the least developed countries. We think it should be at least 50% as a starting point, possibly more. The fourth is that we do need to think about aid effectiveness and aid quality. And this is, again, particularly important because of the fragile states issue and the fact that poverty will be very much concentrated in fragile states. We also, realistically, we need to look at what the evidence of the Paris and Accra and so on aid effectiveness agendas, what worked and what worked less well over the last 10 years since the Paris Declaration. And so the headline recommendations we are talking about is more flexible aid. We need much more kind of adaptive and iterative, flexible ways of providing aid. It needs to be much longer term. We need to be able to make longer term investments. There needs to be more risk sharing. Realistically, if you're going to spend money in fragile states, you can't expect 100% of projects to succeed. It's just not going to happen. And you also need to be faster with how you to provide aid. The Paris agenda is still incredibly important, by the way, but these are the new things that need to be added. And then the last big recommendation we have is to really think about a new multilateralism. We have, as we know, many bilateral donors, huge problems continuing with coordination, with countries not working well together, with alignment, all the rest of it. And we think that one of the ways that you can really tackle that is through greater use of multilaterals. So we're saying where you don't have multilaterals, for example, in social protection, there's no multilateral financing mechanism. We think there should be one. You should expand the Global Fund for AIDS, TB and Malaria to be a wider universal health coverage global fund. We need new mechanisms for humanitarian education and humanitarian emergencies. But more widely, we need to think much more multilaterally, and we think that should be a big commitment for Addis. So that's a whiz through some ideas, but very happy to take some questions.